There's a couple of concerns that you may have, and also how we can help to promote awareness back in New York, and how we can work together.
Well, I think the first things that you can do is, people in a developed country setting, and New York is perhaps one of the most developed or the richest part of the world. They can't very easily relate to or understand what it is that that to have a child who cannot see.
Right.
Because even in the Western world, if we look at the prevalence of childhood blindness, it is about 0.3 per thousand.
Yep.
While in a developing country, it would be about 1 or 1.5. So there is almost a 4 to 5 fold difference between having children blind in, say, New York and children blind in a village in India or Bangladesh. Blind children in a community, and if you can actually go and see any institutionalized or special education schools in New York, and where you can have American children, visually handicapped children, and have their footage along with, say, Indian or Bangladeshi or African children, and okay, both of them look the same, but in case of the United States, this is a very, very small population, while outside it is 4 to 5 times larger, because a simple intervention like a cataract surgery, and sometimes even a simple eye drop like ciprofloxacin that costs just 10 rupees, that is how much, I think, 25 cents. If you take that, you will not have a corneal scar, but then people can't buy that, or even if they can buy that, they don't know where to actually go to look for, to buy it. A pediatric surgery like he's doing a costing, we are doing it. So even if it's costly, it is still $100 to $200. $200 is not a huge amount of money, to save someone lifetime of blindness.
निवांत झोपल्यावर कुंड भांडी पुसून पोटात नख करतो. 11 वर्षांचा हा कुंड गेले
Maharashtra, or rather India, has a lovely campaign that is called as Sarva Shiksha Abhiyan. Like Satish here, he's been working with the Sarva Shiksha Abhiyan people. That means education for all. So what they did in the last census was they actually tried to find out all the kids with disabilities. That's either a physical disability or a mental impairment, or deaf and mute or visual handicap. The premise is if a kid has a disability, that kid can't go to school, so he's out of school. So if you want to have an education for all schemes, you have to find these kids and inclusive, and you have to get them in school. So to get them in school, you have to first treat their disability. So for that, at a government level, using a school teacher and a health center worker, they actually identify all these children. They are all collected in a district at one particular place. And our team goes, sees those children, examines them. Some of them can be treated right away. They are given glasses or low vision, so it's done there and then. There is a small minority for whom nothing can be done. So for them, we refer them to a special education school, a blind school as we call it. And there would be quite a large chunk who can be treated. So now this facility is available in a hospital like this, which has a state-of-art Paediatric Ophthalmology center. So they would be actually brought over here. Like the children you saw in Nandurbar, they have almost driven down 12 hours to come over here.
Yeah, I remember that.
And then we operate them and then send them back. Now, even though it's a government initiative, and a lot of the government does a lot of work, unfortunately there are not that many specialized pediatric ophthalm centers in Maharashtra or in India.
Right.
So that is where actually people like you can come in. Like Orbis International, that's a US based organization.
Yeah.
It had helped us set up this center. So if people can help set up such centers
So
of
there's
excellence
definitely a
in
need for
India.
each of the centers,
Definitely.
because
100%.
people who actually come to the blind school and children who are attending the blind school, they're lucky if you can even call them that, because there's so many other kids who are just not represented because they have no access whatsoever.
And actually, what you said, yes, those children who do come in these special education schools, we in a way pity them. Okay, that's the way they are.
Right.
But in many ways, they are lucky because they are in that school,
Exactly.
which teaches them a lot of values and
Right.
social skills.
Right.
There's so many of them who can't even get to those schools,
Absolutely.
who just stay at home.
Right, exactly.
But then today their parents are looking after them. But 20 years down the line, you will not be sure whether their brothers or sisters would look
Exactly.
after them,
Right.
or later their nieces and nephews would look after them. Because
Absolutely.
there was a study that people who are handicapped, at least in Indian society, they are less likely to get married because they can't find a spouse.
Absolutely.
So they are more likely to be alone.
Right.
They are more likely to be uneducated, more likely to be less educated, more likely to be unemployed.
Absolutely.
So it's just that they are
Yeah,
staying
just-
as
just-
a burden on the families.
आज खेळणार का तू त्यांच्याबरोबर खेळणार
ये तो बहुत छोटी लड़की है मॉन्टेसरी का ही क्लास हुई है तो देखिए
अजून आज कशी शिकायची
हाँ छान